SPD pain during pregnancy. SPD is pubic symphasis disorder. It refers to the pubic symphasis joint right here in your pelvis. So what SPD is a sharp shooting pain, sometimes referred to as lightning crotch. However, that pain can be sharp, shooting fast, and pass really quickly, and it can kind of hang out for a while. It can be a dull, achy sensation. It can not go away as quickly for some as it does for others. The thing about SPD and PGP, SPD, pubic symphasis disorder, and PGP, pelvic girdle pain, are often a collection of symptoms, and they get diagnosed interchangeably many times. So I will have clients who come to me and say, my obstetrician or my midwife has told me that I have PGP or SPD when I describe my symptoms. Now, there are no real tests. Sometimes x-rays can be taken if it's severe enough. However, you try not to expose a pregnant body to unnecessary x-rays. So typically those are not done unless there is severe pain and they're doing diagnostics to try and figure out the root of what's going on. Now, where I see this the worst is in patients and my clients who have some malaligned pelvic girdles. So one hip is, or one of these is rotated forward, is slightly up, or one of them is rotated back. So you have this, our bodies are very adaptable and they adapt to what we put them through. So exercise, workout, our daily routines, our daily postural habits that might not be the best for the functionality of our body can really influence this. So where you may not have noticed this pain before you were pregnant, now you're pregnant, now the hormone relaxin is just, present in your body where it was not before, and it is making this entire pelvic girdle and this joint less stable because relaxin does that. It is intelligent to allow for the pelvic girdle to spread, for this to spread so baby can make their way down through your birth canal for birth. But what it does is it affects our joints before birth. So it affects our pelvic girdle. It can affect all of the joints in our body. It affects, I hear a lot of folks who have low back pain and tailbone pain. There's usually a little tailbone here. I think it fell off in my bag. And all of this, your spinal, your low spine here is connected to this pelvic girdle. So, we've really, really got so much going on, so much that can be affected. And back to, I've been diagnosed with PGP or SPD. How can I treat this? Or how do I distinguish between the two? Well, again, it's a collection of symptoms. So you can check one or two or several of the boxes of symptoms and be diagnosed with one of those SPD, pubic symphasis disorder, or pelvic girdle pain. So as long as you have spoken to your prenatal care provider and they agree that it is not something worse, that they believe that you will be okay doing gentle exercises, stretches, and movements to help improve this, then there is a lot that you can do at home to help make these symptoms better. So stretching is often not enough, and I say that all the time, even as a prenatal yoga teacher and somebody who's a huge fan of stretching. It can do so much wonder for the body, but during pregnancy we also need to gently support our pelvic girdle with mobility practices, with strengthening practices. So the adductor muscles, the glute muscles, our deep core muscles all help support this pelvic girdle. And so if you have musculature and ligaments that are not quite as strong, they are not going to be as helpful in supporting this. So you are going to find things feel a little looser, or if you have those hip rotations, if you have those hip height differences, if you have, any sort of misalignment in the body, you're going to feel those pains probably worse than others. So we work on strengthening, we work on mobility, we work on stretching, we work on breath work to help get things functioning really well. What else I really recommend to the clients that I work with is doing a combination of body work. So Webster chiropractors can help do really gentle adjustments to the pregnant body. They have been specially trained in adjusting the pregnant and postpartum body to get your hips so they are not, at these different rotational angles, so they can help level them off so your pelvic girdle is more even, help if you have a serious pelvic tilt in one way or another, kind of help to correct that pelvic tilt so it's not so far forward or not so far back. These can also, those chiropractor adjustments can help a lot with SPD and PGP pains. Seeing a neuromuscular therapist. A neuromuscular therapist is a specially trained type of massage therapist that works with the trigger points of our body to help release muscles that are that have been affected by this misalignment of our body. So when you have those hips that are rotated in different ways, you'll have muscular compensations going on, and one muscle will really kind of take over and do the workload. And when they're asked to be put under that kind of tension for a long time, you'll find really tight, hard muscles, tight, hard fascia that doesn't move as well. And so those neuromuscular therapists can get in, help release those points with trigger points, can help release that fascia. So we have Webster chiropractors, we have neuromuscular therapists. If you don't have a neuromuscular therapist in your area, massage works really well too. Massage is really great to help reduce some of that tension and tightness in your body. Pelvic health physical therapists and occupational therapists, amazing people to help you function better during pregnancy. I really recommend you find one that has been specially trained in pelvic health, because I oftentimes will hear pregnant clients come back to me and say, well, my physical therapist only did the E-stem and gave me a handful of exercises to do, but they didn't feel prepared, or they didn't really feel that their issues were being addressed. And when I ask if those physical therapists had special pelvic training, they said no. So there is a distinction. Physical therapists on all ends are fantastic, but when they've gone through that extra training to be specifically aware of the pelvic issues that happen during pregnancy and postpartum, there's just another level of understanding. Same with the chiropractors. When they've gone through that Webster certification, they have a slightly better understanding of the pregnant body. And this is not to say that there are not chiropractors and PTs that have not been trained in that and have a really great understanding. I'm not saying that. So I'm just saying that if you don't have a personal recommendation for either one of those body workers from a friend or a family member or a mom group, then those are some distinctions that I like to suggest people look for to help them find a practitioner who's going to be really helpful during pregnancy. Because there's nothing more frustrating than going and spending money on these bodywork treatments that are usually out of pocket and usually kind of expensive, and then saying it did nothing for me. So if you are in the Tampa Bay area, I have a huge network of prenatal, birth, and postpartum specialists that can really help you get you feeling your best during pregnancy. The other thing is, we can help reduce these symptoms by quite a bit, but they don't always go away completely. So keep that in mind. We do our best to get your body balanced and feeling really great and functioning really great. But pregnancy has a way of kind of just throwing some curveballs at us. So learning how to adapt and move. And this week in my reels, this is the middle of August 2022, I'm going to be doing some gentle supportive corrective exercises that help strengthen adductors, glutes, deep core. I will be doing breath work. I will be doing stretches that all help with PGP and SPD. I'm really focusing more on the SPD because that's a lot of the questions I've been getting, so go check those out, and I will look forward to seeing you all very soon. You can also find my Your Empowered Pregnancy and Birth course on sale for this month of August 2022. It is on sale for $34.99, which is like 35% off the course price. And I've been busy adding a bunch of really, really great supportive postpartum content for the first 6 weeks of your postpartum recovery. So you definitely will want to check that out, and you can buy the course now, and when all the postpartum content is uploaded, you'll get that all for free. So I will look forward to seeing you all either over there or in my reels and stories this week, and I hope you have a great rest of your pregnancy, and I'm wishing you all the best.